The Centers for Disease Control and Prevention lists unhealthy dietary behaviors as one of the top 6 risk factors for teen health. Unhealthy dietary behaviors can lead to obesity and a host of chronic illnesses that impact daily life for those affected. One of the most common chronic illnesses related to diet is diabetes mellitus. Diabetes has reached epidemic levels in the United States. An estimated 29.1 million people in the U.S. are living with diabetes, and it is the 6th leading cause of death according to the American Diabetes Association. In fact, every 5 minutes, 2 people die from diabetes, and 14 adults are newly diagnosed. So what causes this disease? What are the symptoms and side effects? How can it be prevented, managed, or treated? These are the questions that millions of Americans are asking themselves as they and their loved ones are diagnosed with this pervasive illness. Diabetes is a disease that affects the body's production and use of the hormone insulin. Insulin is normally produced by the pancreas and helps the body to regulate the level of glucose or sugar in the blood. When blood sugar levels are high, like they are after digesting a meal, insulin allows the cells of the body to absorb the glucose from the blood so they can use it to produce energy. As the cells absorb the glucose, blood sugar levels return to normal. People with diabetes cannot automatically control their blood sugar levels because their bodies have problems with the hormone insulin. When the body cannot produce insulin or has trouble responding to insulin, glucose in the bloodstream cannot move into the cells that need the glucose to produce energy. As a result, the cells become starved for energy and cannot perform their jobs within the body. Additionally, glucose then builds up in the blood. High blood sugar levels can damage the organs of the body. Untreated diabetes can lead to blindness, kidney and heart failure, nerve damage, metabolic conditions like diabetic ketoacidosis, and hyperosmolar hyperglycemic state. If medical intervention is not made, these complications of diabetes can lead to death. There are 3 major types of diabetes mellitus that each have different causes and treatments. Type 1 diabetes is a disorder in which the immune system attacks the cells of the pancreas that produce insulin. Because the pancreas is under attack, it stops producing insulin, and the individual begins to experience the cascade of symptoms we just described. Type 1 diabetes is usually diagnosed in children and young adults. It is not entirely certain what causes type 1 diabetes to occur, although genetics and certain environmental triggers may play a role. There is no way to prevent type 1 diabetes, and it cannot be cured. But it can be treated with insulin therapy, dietary management, and regular exercise. Type 2 diabetes occurs when the body stops using insulin properly, a condition known as insulin resistance. When the body does not respond to insulin, blood sugar levels cannot be regulated, and the individual experiences the symptoms of diabetes. Type 2 diabetes is associated with being overweight or obese and is the most common type of diabetes in the United States. Roughly 90% of all diagnosed cases of diabetes are type 2. Type 2 diabetes is more commonly diagnosed in adults. However, with childhood obesity on the rise, more and more cases of type 2 diabetes are diagnosed in children each year. Because this disease is associated with obesity, it is largely preventable with a healthy diet and exercise. Unfortunately, once someone develops type 2 diabetes, it generally remains a chronic condition that must be dealt with for the rest of the person's life. For this reason, it is best to try to avoid developing type 2 diabetes in the first place, as it is largely preventable. It helps to be aware of the risk factors associated with getting diabetes. If you are overweight or obese, if diabetes runs in your family, if you have high blood pressure, a diet that is high in fat or sugar, or if you are Black, Hispanic, or Native American, then you have a greater chance of developing diabetes, and you should be especially vigilant about taking steps to prevent the disease. Prevention and management of type 2 diabetes involves making healthy dietary changes, exercising regularly, losing weight, taking medications as prescribed by a doctor, and for those who smoke, quitting the habit. The third and final type of diabetes is gestational diabetes, which occurs only in pregnant women. Gestational diabetes occurs when pregnancy hormones affect the body's ability to use insulin properly, which results in high blood sugar levels. Gestational diabetes is treated with diet regulation, an exercise regimen, and sometimes with insulin injections. The symptoms of gestational diabetes usually disappear after delivery of the baby. However, mothers who experience gestational diabetes are more likely to develop type 2 diabetes later on, so careful diet and exercise planning are crucial. Type 2 diabetes is just one of the many chronic illnesses connected to diet and lifestyle, particularly to obesity. In order to prevent diseases like diabetes, it is important to follow a regular exercise routine and develop a pattern of good nutritional choices. You can help yourself now and in the future if you develop and follow a sensible eating and exercise plan while you are young. By establishing good habits now, you will enjoy better health and avoid chronic illnesses in the future. The Department of Health and Human Services says you can reduce your risk of poor nutrition by following the ABC dietary guidelines. Letter A represents the first step. Aim for fitness. This step involves balancing the calories you consume with physical activity to maintain a healthy weight. B is for build a healthy base. Using the Choose My Plate diagram to guide your food choices will allow you to build a healthy nutritional base for your life. Make half your plate fruits and vegetables. Make sure at least half of the grains you eat are whole grains. Vary your protein choices and opt for lean proteins. Choose non-fat or low-fat milk and dairy products. Finally, prepare and store foods safely to avoid food poisoning. The last step in the ABC dietary guidelines is choose sensibly. This means eating a diet with less salt, saturated and trans fat, refined grains, cholesterol, and added sugar. Foods with added sugar are particularly harmful to diabetics and those who are pre-diabetic. Sugars occur naturally in many foods such as fresh fruit and milk products, so they do not count towards added sugar in your diet. Those foods are also packed with vitamins and minerals that your body needs. Foods with added sugar are often low in other nutrients. The most common sources of added sugar in the diet include soft drinks, bakery products like cakes, cookies, pies, and pastries, fruit drinks like punch or lemonade, dairy desserts, and candy. The American Heart Association recommends that men consume no more than 9 teaspoons or 36 grams of added sugar per day, and that women consume no more than 6 teaspoons or 24 grams of sugar per day. The average American adult consumes about 22 teaspoons of sugar each day, which is more than twice the amount that should be eaten. The average child in America consumes 32 teaspoons of sugar in a day, more than 3 times the amount that an adult should be eating. A large amount of added sugar increases the risk for obesity and the chronic diseases associated with obesity, like diabetes. If you can cut down on food choices with large amounts of added sugar, you can reduce your risk of these illnesses. Make sure to read food labels and track your added sugar intake. Try to keep your sugar consumption within the range recommended by health professionals. Other factors to keep an eye on when reading food labels are sodium or salt, fat, and cholesterol content. Making sensible choices rounds out the ABC dietary guidelines put forth by the Department of Health and Human Services. Healthy dietary behaviors and adequate physical activity are key to a long and healthy life. By establishing a sensible diet and exercise plan now, you can help to reduce your risk for health problems in the future and enjoy a lifetime of health and well-being.